Hello and welcome back to today's video. In my last video, I talked about infertility, and when it comes to infertility, semen analysis is unavoidable for the man. So semen analysis is not only meant for a man that is experiencing infertility, okay? A young guy, a single guy that is not yet married can still perform semen analysis to know the state of his spermatozoa, if they are motile, if they are dead, okay, if they are alive, because you don't need to get to the point of getting married, facing infertility issue before you can do semen analysis. You can also do it to know if you have infection. It's not only urine sample that is being used for test for infection or urethral swab. You can as well use semen sample. Just that some people, they don't like, some guys, they don't like producing semen samples for analysis, and this is where you can detect infection easily from. You can perform a urine culture in a guy, you won't see any growth, but once you use semen sample, definitely there will be a bacterial growth on that sample if the person has infections. So in this video, I'll be talking on factors you should consider if you are trying to do semen analysis test. The first thing you have to consider is abstinence. You have to abstain from sex from 2 to 7 days. That is at least for 2 days, but not more than 7 days. This is the first thing you have to consider, okay? Then the second point is collection. How do you produce a sample? This sample collection should be done ideally in the laboratory, okay, or in the hospital, depending on where you are going to perform the test. When it comes to provision, there is always a room in the hospital or in the lab for couples to produce semen sample, okay. So the essence of producing this semen in the lab is to be able to avoid that distance. Maybe you're not staying close to your hospital or your facility, okay, and this sample should arrive in the lab within 30 minutes to 1 hour. So some people, because of distance and maybe traffic and hold them while coming, they will prefer to stay in the lab area and produce this sample. Then if it is unavoidable, you can also produce semen sample from the comfort of your home, but just make sure that within 1 hour you have arrived in the lab to submit it. Also note the production time, okay, because once you come in with the semen sample, they will ask you what was the time when you produce it, okay. So if you produce the sample, for instance, around 9 a.m., try and arrive around that 9:30 a.m. to 10 a.m. same day, okay. Some people, they produce this semen at night and now bring it to the lab, so you can see the distance. So you'll be reporting false results that most of the sperm cells are dead when normally they are supposed to be alive. So always submit your sample within 1 hour. Then the next thing you should consider is method of production. How do you produce this semen sample? That should be the next question in your mind. The ideal method is by masturbation. Yes, that is the ideal method of producing semen for semen analysis. But that does not mean you should form the habit of masturbating, okay? It's not right. Then why do you think that masturbation is the right method? I have some points to convince you why masturbation is the right means of producing this semen. The first point is that if you are using coitus method, that is sexual method, maybe to have an affair with your wife to help you and release fast, okay, you might lose the first portion of that semen, and this is where the highest concentration of spermatozoa are. Okay, so when the first portion has been lost, okay, you'll be reporting false low sperm count. You'll be saying that this person is having low sperm count when normally it's not supposed to be low. It's just as a result of some part of the semen has been lost where you are trying to, put in the container. There's no way you can get the whole semen. Some of them will pour at the walls of the container. Okay, then another reason why we use masturbation method is that volume. When you bring the sample to the lab, we also check the volume. These are the things that scientists consider when reporting semen analysis. So you might be saying that the volume of this semen is not within the normal range without knowing that the mistake was coming from the production. When it was being produced, all of the semen were not able to get into the container. So you can see that it's also leading to false low volume. Then another reason why guys are always advised to use masturbation method is what? The pH of the vagina is acidic, and normally the pH of semen is alkaline. So when semen is being produced through sexual method, okay, it will affect the motility of that spermatozoa in the semen. Okay, so that is another reason why we always advise men to use masturbation method. Another thing is bacteria and cells in the vagina can contaminate the semen, because the nature of the vagina is always moist, wet. There are some normal flora there. When these bacteria are being seen in the semen, you wouldn't know where it is coming from. Is it coming from the semen or from the vagina? So these are the reasons why we advise people to use masturbation method. Then when this semen is being produced, normally is viscous. You understand, is always thick when produced, and with time it will become watery. Okay, all these are things that we note when semen are being submitted. Another thing is volume. We check for volume of the semen. The normal volume of semen is around 1.5 mils to 2 mils. Okay, so when you check this semen and the volume is reduced, you have to consider how the semen was produced, that it will not report false low volume. Okay, so 1.5 to 2 mils is the ideal volume of semen. It can be more than 2 mils too. Then another thing we check is the pH of the semen. pH of the semen is always alkaline in nature, so the normal pH is around 7.2. Okay, but sometimes it can be slightly increased to 7.8 when the pH of the semen is being increased. It can be due to infection. Okay, so that is why we also perform culture tests on most semen samples, so to know if the person has infection and the type of infection the person has. Then the pH of a semen can be acidic too. So it can be acidic due to the seminal vesicles failure to develop, the vas deferens epididymis. When they do not develop, from birth, they can make semen sample to be acidic, and in this case, you will not even see any single spermatozoa in that sample. That is for the pH. Then we also check for the percentage of the viable and motile spermatozoa. Okay, the spermatozoa, they can be alive. Yes, that is viable. They can be alive, but they are not motile, because normally a sperm should be motile, like either in a linear way, but that is the only way it can move to the fallopian tube to meet the egg. So we also check for the viable sperm cells and their motility. So all these things are things that will report, okay? And finally, we do the sperm count to know the the count of the semen per ejaculate, okay? When you do your count, if any value between 15 to 200 million, okay, per ejaculate is normal, but anything less than 15 million, person might be considered to have low sperm count depending on the region, okay? Like the Caucasians, they have their values, Africans, Asia, they have their own reference range, okay? So these are the things that you have to know before performing semen analysis. I believe you've learned one or two things from this video. If you have not subscribed to my channel, consider subscribing. Click on that like button. Do drop your comment if you have any contribution or question. I won't waste time to answer you. Thank you for watching to this point and see you in my next video. Bye for now.